Chairman, damn. I got a few presidents here, too. Helen. Billy, we ready to roll? Okay. Thank you very much for being here. The media, you've been great partners. I deeply appreciate that. The Focus Springfield, you've been invaluable, making sure that we've been able to keep transparency and public meetings going on for our community. I'm joined here by well-respected leaders in their fields. Of course, our Commissioner of Health and Human Services, Helen Colton-Harris, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Roos, and my friend and colleague on the City Council President Marcus Williams. I've told you from the beginning, when we've had to deal with natural and man-made disasters, that I would always tell you what was going on, what happened, what we're going to do about it, and that we're going to be able to get through this together. Hope. We've had some disparaging numbers come up in dealing with COVID-19, and it's not for trying. Helen and our medical providers have done yeoman work on reach out. This new Delta variant is causing some issue now. It has become a pandemic of the unvaccinated. When Dr. Kerouac and Dr. Roos speak, they will tell you the high percentage of unvaccinated people coming to their respected health institutions. That is taxing them and their staffs. And that potentially could take away from all the great other medical services and hospital services that they give to the city of Springfield and surrounding areas. Let me give you some stats. We have about a population of 156,000. Of that, 84,477 individuals have received the first shot. So when you look at it, fully vaccinated here in the city of Springfield is just 47%. That is completely unacceptable. Helen will get into you with the numbers. The cases since July 25th, 2021, 122. Now our cases are continuing to escalate 500 plus a week or more. Of that, we've been saying it before, it's really the younger population. 55%, or about 300 of those 574 cases, are well under the age of 30 years old. Again, to our younger population, they feel that they're invincible. I hope they are. But you have to get that shot. 54% Springfield residents have received their first shot. Of that breakdown, 42% are African American, 36% are Hispanic, 64% are white. God knows that Helen and the whole team here and others, we have reached out tremendously to make it as convenient as possible, especially to all our population, but especially to our minority population. Fully vaxxed, African American, 37%. Hispanic, 31%. White, 59%. I give you all these things here because we're going to, this is as of August 31st, we're going to be making some temporary moves now to not give this Delta variant a host, that it can continue to spread. We have met, Dr. Kerouac and Dr. Roos addressed the business community, EDC, early this morning on these moves we're going to announce to you. Myself and Commissioner Helen Colton-Harris met with our beloved T-Birds just yesterday or the other day as we look forward to opening the game opener on October 16th, which I will be there as a season ticket holder. So when you look at this, moving forward, we continue to be proactive. We're balancing all the decisions that we've made based on public health, medicine, and scientists, and I'm balancing trying to keep the economy going. Take one step forward. I don't want to end up taking 2 steps back. We've all worked so hard in this situation to defeat this COVID-19. And when you look upon it, and Bay State will explain their situation, and Mercy will explain their situation, but we have to cut down the number of targets, which means you and me, and all the viewing and listening and reading audience here. The less targets you have, the quicker that this variant will not spread, and we can eventually get rid of this COVID-19. The vaccine works. It's not a 100% cure, but if you are vaccinated, it is proven that it can keep you safe. If you get any of these breakthrough situations, which are limited in scope, sometimes you don't show any symptoms. You don't really get sick. You don't get hospitalized. You don't die. So the vaccine works. And that's important for people to know. I know people don't want to wear the mask or want to stop wearing the mask. Very simple, very simple. You want to stop wearing the masks? Shots in the arms, shots in the arms. Get the vaccination. That's extremely important. So, before I turn it over to Council President Marcus Williams for a few words, under the authority, under the Board of Public Health, as we've done before, order has come out that masks need to be worn citywide. Citywide. Commissioner Helen Colton-Harris will get into the exacts of the public health order, which we have the authority to do that. This is not forever. This will start Monday, September 13th, 2021 at midnight, and will end November 1st, 2021. Now, if things get better, vaccination rates go up, COVID cases go down, and again, the majority of those COVID cases are the unvaccinated ones, we can look to rescind this. But right now, we have these warning signs, and I take my information and I respect the information and the advice and wisdom that I receive from Dr. Kerouac, Dr. Roos, and Commissioner Helen Colton-Harris. The red flags are showing now. We cannot sit back anymore. So this is a call to arms, pardon the pun, that people really need to get this vaccine ASAP, especially our younger population. And we do that, we limit the targets, we starve the COVID-19 virus, this variant, the Delta variant, and we can continue to move forward in our lives and our activities. So this will become an effect, and that means that those masks have to be worn, especially in the inside aspects. Businesses will continue to go on, but you have to wear those masks. And Commissioner Helen Colton-Harris will get into some type of clarification when it comes to outdoor activities too. But if we don't do this, we're going to open the door to take 2 steps back. And I'm not going to allow that to happen. I know you've been patient. I know you've been cooperative. I know you've been aggravated. But this is the right thing to do. Some people will be very happy with this move, others will not. And on the eve of 9/11, 20-year anniversary, where that tragedy occurred, many a times we come together during tragic times and work together as one. I just don't understand the division that has occurred, because this is a tragedy that is occurring with this COVID-19. And instead of people working together, there's entities that want to work against each other And I've always said that conspiracy theories have never solved a medical challenge. Vaccines do. And to those that are hesitant there, trust the facts. Not stuff you see out there on social media. Just think back to polio, measles, mumps, rubella, all these things here that when the vaccine was formed, everybody took it and welcomed it. And those things have gone by the wayside. That's the way we have to think about this COVID-19 and this Delta variant moving forward. So with that, I'm going to turn it over to my friend and colleague, Council President Marcus Williams, for a few words. He's been fantastic to work with. And then I'll bring up Dr. Mark Kerouac and then Dr. Roos, and then we'll close with Commissioner Helen Carlton Harris and take any questions or comments you might have at that point in time. City Council President Marcus Williams.
Thank you, Mayor Sarno. Thank you to our doctors, both at their respective institutions, Mercy Medical and Bay State. And thank you to, of course, our Health Commissioner, Helen Carlton Harris, who's been dynamic and great to also work with as we have faced this pandemic from beginning until its current situation. This is certainly not a decision that is taken lightly. There are several factors that go into why it is a wise one for the city of Springfield to take. I have to give, because my mother is one, so it would not be acceptable not to give a shout out to our healthcare workers who have been on the front lines since day one, knowing we all know that they are exhausted, they are tired, they are sick of seeing the same type of scenario happen time and time again. So we must keep them in our prayers and our thoughts, as we probably to this point all know someone who has been affected in the healthcare industry. I also want to urge folks, along with wearing masks, to also get vaccinated. And I am speaking particularly to those in Black and brown communities. This country has had a long, devastating, and daunting history of experiments that have failed and that have been inhumanely put on people that look like you and me. But the time to get vaccinated is now. It's now because when I think of our most precious cargo, our children, as we've seen, this Delta variant has passed to them more quickly and swiftly than the variant before. And that should be reason alone for why we should stand up and why we should protect our most precious cargo. We all have a responsibility to protect public health, as we are all a part of the public. And it's going to take an entire city to lower these numbers. The COVID-19 response subcommittee, as created by myself some time ago, led by Councilor Letterman, has been meeting with the healthcare leaders of the city, as well again with our commissioner, to stay abreast of the numbers as they happen in real time. And as we've seen, there's been a devastating spike that is taking place, and it's been for consecutive weeks. We must do more. We must do more. So with that being said, I want to thank you all for taking this step to protect public health and wish you and your families the best as we still get through this pandemic, but of course, by working together. Thank you.
Thank you, Mr. President. Thank you, Council President Marcus Williams. Appreciate the friendship and the partnership. And as Marcus also indicated too, and Commissioner Helen Carlton Harris will indicate, we are being uniformed to what we're doing at City Hall and all our municipal buildings. This order runs concurrent with the city buildings also. And we've been able to, again, open up our schools, which we did last spring, and summer school, and now with all the proper protocols. But as the Council President indicated, we need to think about protecting our kids. Now, I mean, to get the perspective now of what our respected hospital officials and their staffs are going through now at this breakneck pace of 24/7 and many other challenges that they're facing. You'll have Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and then Dr. Robert Ruse, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare. We'll first bring up Dr. Mark Kerouac.
Good afternoon, everybody. And Mr. Mayor, President Williams, Commissioner Carlton Harris, I really very much appreciate your strong leadership and your partnership. I have to say I am sorry that I have to be here today. The fourth wave has hit Bay State Health very hard. We've gone from only 4 cases in the hospital in early July to more than 100 over the last few weeks, 101 today in all of our 4 hospitals. Since the beginning of the pandemic, the burden of the pandemic has been devastating to our system. Over 4,000 patients admitted, 585 deaths. This time around, this particular surge, which began in mid-July, is largely due to the Delta variant. Over 95% of the cases we're seeing are Delta. And as the mayor said, it is largely an epidemic among unvaccinated individuals. 75% of all of our cases and an even higher percentage of our most severely ill cases are in unvaccinated individuals. In that minority of cases in which it's a breakthrough infection from a vaccinated individual, the cases tend to occur in individuals with chronic conditions, advanced age, and surprisingly, they tend to be less severe, shorter lengths of stay, less likely to be in the ICU. This is all coming at a time when demand for non-COVID care is resurging. People who would put off routine care of chronic diseases or preventive care are trying to come back and get taken care of for other things. We're seeing an increase in demand for behavioral health services, particularly among kids who've been isolated during this whole pandemic. And we're dealing with significant staffing shortages. We now, as a result of early retirements, resignations, and leaves, have 1,400 open positions among our 12,000 employees. We've done a number of things to try to get our arms around this, including raising salaries, enhancing benefits, bonuses, hiring travelers and contractors, but the gap is still there. There's also a significant gap in staffing at many of the area nursing homes, making it harder to discharge patients to nursing homes. This has resulted then in virtually all of the area hospitals being at or even beyond capacity, and certainly all the large tertiary care systems to whom we might send overflow are beyond full as well. The problems with vaccination in Hampden County are very much behind the surge that Bay State is seeing. Right now, today, of 600 inpatients across the state of Massachusetts, 100 are at Bay State. So that's 16% of the inpatients in the state of Massachusetts are at Bay State, even though we only have 5.5% of the beds. So 3 times more than what you'd expect if cases were distributed evenly. Our response to this pandemic has been similar to previous ones. We've stood up a command center. We're administering monoclonal antibody treatments at Bay State Noble, over a dozen a day, patients coming in. We have a home care program to administer high-flow oxygen so patients can cut their stay short and recover at home. We're using antiviral drugs, anti-inflammatories. To deal with the capacity issues, we're trying to use our community hospitals, but as I mentioned, those themselves are filled. Trying to cut down or ratchet down on transfer acceptance from out of the area, and even looking at postponing elective cases. Our senior leaders are working every day to swing additional resources to help our very tired and very stressed staff. I don't need to remind you that Bay State Health provides a number of very unique services for all of Western Massachusetts. We are the only level 1 trauma center, the only neonatal ICU, the only heart surgery program, the only center offering procedures to open an artery in the case of a heart attack or a stroke, the only place with specialty pediatrics, specialty cancer care, high-risk obstetrical care. Many of these conditions, like high-risk OB, trauma, heart attack, if we have to transfer patients out of the area, the outcomes are worse. I had to face, during the weekend of Hurricane Henri, one of the things I've been most frightened of. Our hospital was so filled and our emergency room was so backed up on that Sunday that we almost got to the point of saying we can't take any more ambulance traffic and have to send patients to Boston or Hartford, knowing that patients would have a worse outcome if that happened. We were able to avoid that, but we really have been operating on the edge for the last several weeks. That is what led me to discuss my problems with the business leaders this morning and with Mayor Sarno, Commissioner Carlton Harris, because at the end of the day, Bay State Health is owned by this community. Springfield Hospital has had its home in Springfield, now Bay State Medical Center, for over 130 years. And we've never had to close our doors to people who need us. And I really don't want that to happen now. But we really need the help of the community to get COVID under control, particularly since so much of what we're seeing could be completely prevented. I know that Commissioner Carlton Harris, Dr. Roos, and I have been working very hard to promote vaccination in all the neighborhoods of the city through education, pop-up clinics, mobile vans. I was pleased to see that Commissioner Carlton Harris had already secured the support and cooperation of the Hall of Fame for the enshrinement ceremony, as well as the Thunderbirds for their large indoor events. That was real progress. But we all agreed it was time to sort of ratchet up the layers of protections. It's very clear that vaccines are safe and effective. If you get a COVID vaccine, you are 8 times less likely to be infected with the Delta variant. And if you do get infected, you're 25 times less likely to wind up in the hospital or dead. Those are huge improvements in your odds of staying healthy. We also know that masks are protective against COVID. Masks have been shown to terminate outbreaks and have been studied in numerous countries and found to add significant protection over and above what vaccines can do. So we're talking about adding an extra layer until this thing quiets down. So my message, very much like it's been in the many Mondays that I've come here at this podium, is please get the vaccine. Urge those that you love to do so as well. And please wear a mask if you're in an indoor public place, particularly if it's crowded. I think reducing the spread of COVID is going to keep us all healthier. It's going to allow us to return more quickly to normal life. And it's going to maintain the vital and unique services of Bay State Health for people who have serious non-COVID conditions. Again, thank you, Mr. Mayor, for the opportunity, and President Williams and Commissioner Carlton Harris for your leadership as well.
Thank you, Dr. Kerouac. You heard the perspective from Bay State Health Systems. You are now going to hear the perspective from Mercy Trinity Healthcare from Chief Medical Officer Dr. Robert Roos.
Thank you, Mayor Sarno, and good afternoon, everybody. I want to thank you, Mayor, and applaud you and the City Council and Commissioner Carlton Harris and the entire Cabinet for the announcement today. And what underlines that announcement is really a very important science-informed decision. That has been the approach here in the city of Springfield all throughout this pandemic over the past 18 months to make decisions and to help encourage and support the public health in the spirit of what's best for this community. And it's been a privilege for me to stand alongside, offer guidance, and collaborate with leaders like Dr. Kerouac at Bay State Health to try to guide some of those decisions in the ways that we think are best. Today, I'll provide an update, as we did for many months, from Mercy Medical Center's perspective and Trinity Health, recognizing, as it was said, we are in a moment right now a full 18 months after the first cases here in Massachusetts were identified, and the vast majority of people in this community, not only our healthcare workers that I get the fortune of working with each day, are exhausted. This is beyond the point of fatigue. Pandemic fatigue is something that we talked about a year ago. People now are at a point of exhaustion. It has led to people changing decisions about their work, about their life, and it's unfortunate, frankly, that we are still in this situation at this point in the pandemic, despite all of the science, the advancements, the incredible safe and effective vaccines that came to market for our communities. But yet, I know that we will continue to persevere. We are resilient, and we will continue to press on, making the decisions in the best interest of each other. But this is an important moment. This is the fourth surge, and the rates of hospitalization continue to go up because there are vulnerable people in our community, and the virus is still circulating. At Mercy Medical Center, we have seen an increase in our hospitalized cases significantly over the past 4 to 6 weeks. Although our scope and size is different, at Mercy, we've seen that number quadruple. We were at a point of 0 infections in June, and we were in the single digits for many weeks. And as of this morning, we had 14 hospitalized patients at Mercy with 1 in intensive care. That's a 15% of our inpatient census, give or take. And we've seen our test positivity rates for all the tests done performed through the hospital continue to go up over the past 4 weeks, from lows that were well under 1% not too long ago to now over 6%. The numbers of patients hospitalized now are very similar to what they were in March and April in our third surge, and unfortunately, we haven't seen them yet totally abated. And that's because we are still very much amidst a larger pandemic that the local environment is experiencing, but is very much connected to what's happening across the globe and across the United States. Across the world, there's been over 222 million infections. There are still over 600,000 new infections every single day. In the United States, there's now been over 40 million infections, and we're seeing over 150,000 new infections per day. And unfortunately, while the death rates have gone down significantly with vaccination and advances, about 1,500 people are still dying each day in the United States from this virus. In Massachusetts, it's about 1,500 cases per day with a test positivity of 2.3%. And while deaths have been in the single digits, hospitalizations have crept up and have not yet started to go down and have approached and been at about 600, as was mentioned. Western Massachusetts is disproportionately seeing the impact of these cases, as Dr. Kerouac mentioned, with far more hospitalizations reflected here in Western Massachusetts outsized to the total number of beds. Hampden County, outside of Dukes and Nantucket counties, has the highest incidence rates, or the rate of new infections per population over the last 14-day period, than any other county in Massachusetts, at about 34 infections per 100,000 residents. And as was mentioned, the rates here in Springfield have been going up and remain of significant concern for the local community. It is because of the Delta variant. That variant has caused over 95% of all new infections across the country. It's probably even closer to 99%. The Delta variant is more infectious than prior variants, so each individual sick person will infect perhaps as many as 6 or 7 others in normal conditions if those individuals are vulnerable and not vaccinated. That's about twice as infectious as prior variants. It also can be more severe, and so individuals who are not as protected without vaccination, who get the Delta variant, studies would suggest that they may be at higher risk of suffering complications. This is of most concern for the unvaccinated. It's stated as a pandemic of the unvaccinated, and we are seeing the rates of those infected, as well as the rates of those, which is most importantly, those that are hospitalized or with severe infections, overrepresented amongst the unvaccinated. With at Mercy, more than 80%, and early on, more than 90% of those hospitalized were not vaccinated. We've also seen the rates of hospitalizations amongst children and adolescents increase by about 5-fold over the last 8 weeks throughout the country. Really driven not so much by a change in the virus, but driven by the overall rates of infection amongst children and adolescents growing very rapidly in many parts of the country. So there really are two things that are key here. Vaccinations, which is really the most essential strategy to combat this virus over the long term. It protects against infections and against serious illness. But until the entire community and population is vaccinated, we still have many people that are vulnerable. And unfortunately, in Hampden County, we have one of the lowest rates of vaccination in Massachusetts, and disparities exist amongst race and ethnic groups. Despite the incredible efforts that have been put forth here in this city through many collaborations led by the City of Springfield's Department of Health and so many others. And so that's why masking and really the public health basics, the strategies that we've been talking about for 18 to 20 months are so critical. Because not everybody is vaccinated, especially those under 12 where they're not yet eligible. Vaccines are incredibly beneficial, but they're not a panacea, and they don't provide 100% infection, 100% protection. There are breakthrough infections, and it is happening more with the Delta variant, and it could then spur different and more resistant variants to occur. And lastly, and most importantly, and this was mentioned, masking is incredibly effective. It is incredibly effective. It's been shown in multiple studies looking at large-scale populations, countries, in smaller settings. Masking has the ability to protect against not only the coronavirus, but many respiratory viruses for which airborne transmission is the main route. That's why several months ago, the Centers for Disease Control and Prevention recommended masking for all individuals, vaccinated or unvaccinated, while being indoors in areas of substantial or high community transmission. In Massachusetts, all counties, with the exception of Franklin County, at the moment are considered to be of substantial or high transmission risk related to the numbers of new infections on a daily basis. So we are in a local area here in Springfield and in the surrounding cities and towns where we have lower vaccination rates relative to the rest of the state, even if they're higher than many areas of the country. We have disparities amongst certain groups, particularly people of color, and we are now seeing the rates of hospitalizations go up in all of our hospital systems in Western Massachusetts. This is happening, unfortunately, at a time where we could predict that more infections will come. The weather is changing. People will begin to gather indoors more than they were in the summer when they were spending more time outdoors. Schools are back in session. And we are on the cusp of many large, significant events. And people tend to gather in larger gatherings as we move in towards some of these for the fall. Not to mention, we're also at the beginning of what could be influenza season approaching soon. So this is a combination of multiple different dynamics that putting this at a critical moment. It is indeed a call to action. Our system and our hospitals are not invincible. Our staff are incredible. They've been valiant workers, tireless workers, dedicating their lives selflessly to help others coming through the doors. But they are tired. They are fewer than they were 2 years ago, and they need your support. At Mercy, we've taken steps to protect our workers in many ways by ensuring that they all are vaccinated through a vaccine requirement policy, which goes into effect in a couple of weeks. And in healthcare institutions, we have always utilized masks in all areas of the hospital, maintained physical distance, avoided any large gatherings as a matter of policy and practice, and ensured that people that have symptoms don't come to work. because we have the most vulnerable people within our care. But those vulnerable people could be the person next to you in the grocery store, could be the person out at a large gathering, could be somebody that you walk by when you're shopping. And so I plead us all with this important action to heed the advice, to wear masks, to stay safe. And I want to applaud the mayor and the city council for their decision and encourage everybody to stay healthy, to stay safe and resilient, because we will get through this together. Thank you.
Thank you, Dr. Ruth. The close with the cleanup hitter, Pension Award winner, Rotarian Paul Harris Award winner, the elegant and eloquent Commissioner of Health and Human Services, Helen Calton Harris. She'll set it to you straight, as all these other individuals have done, and she'll also speak specifically to the order, public health executive order that is being put across, and what we need to do immediately now to tamp this down so we can move forward. The Health Commissioner of the City of Springfield, Helen Calton Harris.
Thank you, Mayor Sarno. Thank you, Dr. Kerouac, of course, City Council President. Thank you, Dr. Ruth, for being here. And as always, thank you, Mayor, for your support. The Commonwealth of Massachusetts, City of Springfield Board of Health, COVID-19 mandatory policies and procedures for wearing of masks or other face coverings in the City of Springfield. Whereas the Delta variant are now accounting for approximately 98% of positive cases in Massachusetts, and cases have appeared in Springfield, and whereas these variants are almost always twice as contagious as the previous variants. Whereas we see the cases rise in surrounding counties and community during this summer with travel and gatherings, we are committed to preventing transmission, keeping our numbers as low as possible, and preventing our most vulnerable from severe illness with a new mask mandate. Whereas, according to the CDC, given what we know about the Delta vaccine effectiveness and current vaccine coverage, layered prevention strategies such as wearing masks are needed to reduce the transmission of this variant. Now, therefore, commencing on September 13th at 12:01, the following policies and procedures must be implemented at all times in all specific spaces in the City of Springfield. Authority. This order is promulgated under the authority granted to the Board of Health under Massachusetts General Law, Chapter 111, Section 31, as well as Chapter 533 of the Acts of 1980. Definitions: performers, those singing and or playing wood, wind, or brass instruments, performing artists, and those speaking or presenting at events. Specific indoor spaces. The term specific indoor spaces will include all places in the City of Springfield unto which members of the public are invited or otherwise allowed to enter a building or structure or to interact with any persons in order to transact any public or private business, including all public indoor spaces, and shall include but not be limited to restaurants, bars, indoor performance and event venues, hotels and motels, gyms, fitness clubs, salons, places of worship, as well as indoor workplaces and common areas of multi-unit buildings. Team sport includes any sport which involves players working together towards a shared objective. A team sport is an activity which a group of individuals on the same team work together to accomplish an ultimate goal. Section 3, policies and procedures. Except as specified in Section 4, masks will be required regardless of vaccination status for those over the age of 2 as follows. Masks or face coverings shall be worn in all specific indoor spaces in the City of Springfield. Food service establishment with employees shall wear a mask or a face covering when serving customers, both indoors and outdoors. Masks will be required in outdoor public events where physical distance of 6 feet cannot be maintained. This includes, but not limited to, events held at fairgrounds and outdoor performance and event venues. Masks must be worn in the dugouts, benches, and other common seating areas for outdoor moderate and high-risk contact team sports, including but not limited to baseball, softball, track and field, volleyball, soccer, running clubs, team swimming, volleyball, dance class, fencing, field hockey, soccer, football, wrestling, rugby, basketball, lacrosse, ice hockey, competitive cheer, and martial arts, ultimate frisbee, boxing, and pair figure skating. Exemptions. Nothing in this order is intended to encourage residents to act as enforcement authority for the City of Springfield. Residents should not take it upon themselves to approach people in violation of this order. Residents are urged to focus solely on their personal compliance with this order. Nothing in this order shall be construed to require a mask to be worn by children under the age of 2 or children who frequently compromise mask integrity with frequent manipulation or removals. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, or anyone who cannot wear a mask for other underlying health and safety reasons. Employees in shared office spaces are not required to wear a mask if social distancing of 6 feet or more can be maintained. Performers who are singing and or playing brass or wind instruments, who are performance artists, or who are presenting or speaking at an event are not required to wear face coverings, but must adhere to the social distancing of at least 10 feet from any member of the public when performing indoors and outdoors. Face coverings are not required and shall not be worn when actively participating in water-based activity and when swimming. Wearing a mask in these circumstances increases a drowning risk. Face covering shall be worn at all times when not in the water, including but not limited to indoor pool decks, locker rooms, changing rooms, and restrooms. Enforcement. The person or entity in control of a public indoor space shall have the obligation to enforce the requirements of the mask mandate set forth in these policies and procedures. The person or entity in control of a public indoor space, himself or by his servant or agent, or as the servant or agent of any other person or firm or corporation who violates any reasonable health regulation made under this authority of this section, for which no penalty by way of fine or imprisonment or both is provided by law, shall be punished by a fine of not more than $300 per day. This order is in effect at 12:01 September 13th and will remain in effect until November 1st unless otherwise amended or rescinded. And it is signed by the Board of Health and by myself. The mayor and I wake up most days looking at numbers, and it's very disheartening to see the numbers that are coming across for the city of Springfield. I think we hold our breath each time we send the numbers or I get the numbers. And I hope these numbers are going down. That is my wish and my prayer, that our numbers in this city go down and our vaccination rates go up. That is not happening. And because that is not happening, this mask mandate is necessary. Today, I had 129 cases of COVID-19. We will give you the complete number for the week on Monday. However, 129 is amongst the highest rates I have seen in quite some time. Another concerning data point for me is that a long-term care facility in our city now has 6 of its residents who are COVID-19 positive. Why does that make a difference? Because I have not seen long-term care facilities come through with positive cases in a very long time. So this tells us that we are in a very difficult time as far as this pandemic is concerned. Each individual who has come to this podium have asked you, please get vaccinated, please wear a face covering, please care about your families, care about yourself, care about your children. The other numbers that we're seeing that is consistent with what's happening across the nation is the under 20 age group and those positive cases that we're seeing. And we know that those young folks cannot be vaccinated because many of them are not eligible. So we are in a very difficult time, and we do not want to lose one resident of the city of Springfield or the Western region for that case. The other data point, I think, is I'm seeing the positive cases skew older. So if you recall, the positive cases were absolutely in the younger ages. And while they're still there, they are skewing positive older. Those are the individuals that will probably wind up in the hospital and probably wind up needing to be cared for. So we're asking you, all of us are asking you to do the right thing. Get vaccinated, wear your face covering. The mayor did not want to take this step. I mean, when I say he didn't want to, it wasn't something that any of us thought that we wanted to do, but it's necessary. It's so necessary. And so, as the mayor has said consistently, we will do what we need to do in order to protect the health of the residents of the city of Springfield and certainly the Western region. I will end by saying what everyone knows. A mask is not a political statement. It's a mask. And it's a mask that is here to protect. So when someone is wearing a face covering or a mask, think about the fact that they're thinking about you. They're thinking about who's with you. They're thinking about who's next to you. And so we just hope that you will remember that this is all to save lives. And that's the goal for everyone you see behind me. Thank you.
We will take any questions or comments you have. You heard from the experts here, and we don't make these or take these moves lightly. The next thing we want to try to avoid is more restrictions. So the ball's in your court. Next thing that you try to work, mandates. Many mandates are being done as they should be done. So these moves being made now, and we want to look at it for less than a month. If we can get those vaccine rates up, and we get the numbers down for Helen and myself, and especially for Dr. Kerouac and Dr. Roos, we have it under control again, and we're headed in the right direction. We make these moves now, so we'll be stronger in the very near future. So as Commissioner Carlton Harris said, this is not about politics, getting a shot, wearing a mask. This is about public health and common sense. So with that, let me open up any questions or comments for any individuals that are up here. And I really deeply appreciate the media being here. We're using every avenue we can to get information, proven facts information out to dispel the misinformation that is out there and to focus Springfield. Again, you've just been fantastic as we continue our public transparency. So any questions or comments you might have, all the individuals up here. Let me go to Sydney back there first.
So there's just a last minute when it comes to restaurants and bars and no capacity limits and people need to be seated, or is it?
As of right now, no capacity restrictions. Helen, myself, we don't want to get to that point in time. So that's why these moves have to be made now. And Dr. Kerouac in our conversation made a good point. Even sometimes, and again, enforcement, we're going to do what we did before. We were very good about educating. The board, Helen and her team goes out there, if needed, Commissioner Clapper, but we try to educate first. You know, early on, we had a couple issues. They were dealt with stronger enforcement. But Dr. Kerouac can indicate, just continuing to knock down the percentages is going to be a win if people are cognizant. So no direct restrictions on that case. We want to try to avoid them. How can we try to avoid them? People get the shots, wear the masks now, adhere to all the public health policies. Let's see where we are in less than a month's time and move forward. If things don't improve, that leaves myself and the medical professionals no other choices to come with more of a heavier hand, and we don't want to do that. So right now, it's about the masking. I don't know if anybody else wants to add anything more on that. Okay. Liz Mania? I'll let Commissioner Colton Harris. We've been able to do our high school sports pretty well, too.
So we currently have a mask mandate for Springfield Public Schools, as you know. And we are vaccinating children as much as we can at this point as well. So masks are required right now. So that was a policy that was put in place last year. So this is really just an enhancement. You know that Springfield Public Schools and many public schools, the children must wear masks indoors. And for sports, we are wearing face covering and limited the number of individuals who are in our building. So right now, basketball will not have individuals who will be spectators. So we're doing everything we can with the sports teams that we have to assure the safety of the children and certainly of the parents.
Thank you. Paul, I'm sorry. Excuse me. Yep, go ahead.
So the order says that there are restrictions for people singing using wind instruments, and so that will impact them. Most houses of worship that I've spoken to have not gone back with their choirs at this point. We know that this is a respiratory virus, and certainly indoors and singing and wind instruments is certainly going to have an impact, I believe, on the cases that we have in the city of Springfield. So the order does speak to that very specifically.
Any other questions or comments? I know in Mount Carmel we're wearing masks and we go to church. Paul, yep, Dr. Kerouac. Then Liz will go to you.
Well, I think that the leadership of public health in the state of Massachusetts is at the level of the towns and municipalities. So there are 351 different governing bodies involved, and it does create some inconsistencies. I think that there is certainly a leadership effect. I think Springfield is stepping out and being a leader in Western Mass in this area. I think that may only be the third city or town in the West. Boston has gone there, Hartford has gone there, but it's still a minority of towns and municipalities that have taken this step. And I think that steps have to be appropriate to the amount of COVID that you're seeing and how well it's being contained. And Commissioner Colton Harris told you that the numbers are heading in the wrong direction. If we were in the eastern part of the state where there's a lot more vaccination and the numbers are quiet or maybe going down, I wouldn't feel as strongly about this.
Just to let you know, I did speak with Governor Baker late yesterday afternoon, early evening, in between my ARPA meetings, and he offered any assistance that, he's been great, any assistance that we need here. Again, we don't make or take these decisions lightly at all. Liz? I got to pull out my cheaters or else I'll be playing the trombone here. The numbers according from August 31st, and again, Helen got the numbers just not too long ago. Today was 129 today. So we were looking at overall population about 156,000 here in the city of Springfield. First shot that we have recorded now, 84,477 have had the first shot. By the way, Billy Baker, my communications director, when you're in the package, you will get the executive order, the public health order, and we might have some more information for you too besides the press release. 54% have received their first shot, one shot. 47% totally vaccinated. It's a terrible percentage. Of that, 42% African American, first shot. 36% Hispanic, first shot. White, Caucasian, 64% first shot. Fully vaccinated, 37% African American, 31% Hispanic, 59% white or Caucasian. Those are the numbers as of on the state has confirmed. We have tally our numbers. We have to go off their numbers. It's of August 31st of this year. Any other questions or comments? Yes, Sydney. Yeah, here's the thing. They were very cooperative and worked together. My style or our style first is to educate, to get this information out there. If something was to arise, to warn. And then and let me tell you, Helen, she was out many a times, 24/7 with her team. And when needed, we did have a couple times where Commissioner Clapwood would send our men and women in blue to send a strong message. And I think if you ask Helen, we really only had a handful, am I correct? A handful of really big issues, whether it was small places or box stores, which she checked constantly. But in this executive order or public health order, there is a $300 fine to the person and or entity that's controlling that venue or establishment. We don't want to get to that point in time. And my angle to them, we've all said it, the professionals have said it here, and Council President Williams, do these things now. So if you do these things, we don't have to go down the road of more restrictions, possible mandates. So that's why we're doing it. And again, we put a tight time frame. 13th Monday will start. And we look November 1st, which runs concurrently with what we are doing here with all our municipal buildings and schools to preserve and protect our workforce. So the businesses did it before. They can do it again. This is to safeguard all their customers and safeguard themselves and their staffs. And hopefully this is the last restrictions that we have to do. But you can't. It's an alarming rate that these numbers are increasing now. And I'm going to go back, and Dr. Kerouac has said it too. Dr. Roos, this has become a pandemic of the unvaccinated. And not from us not trying. Helen and the doctors, we've done vaccine. Do you remember when the vaccine first came out? People couldn't wait to get, how can I get the vaccine? Now, it is plain and simple. It is so easy to get that vaccine. So politics cannot be played here. I will not play politics. I have not played politics on it. We base the decision on public health, medicine, and the sciences, and I've been very cognizant of trying to keep the economy going. Dr. Kerouac served on Governor Baker's board, and even as a medical professional, he was very cognizant about that, saying, hey, we have to try to balance and keep businesses also going. So we're trying to be proactive here and not all of a sudden you get blindsided, hey, things have to shut down. We don't want to get to that point in time. So I need the public it's a fourth wave now, to work with us, bear with us, for the common good of each and every one of you here in the city of Springfield. So that's why we wanted to come to you this mid to late afternoon and the media to get this word out. And we're doing it for you and your families. So I hope that you listen to the sage advice coming from the individuals here and businesses. Again, you know, I'll always work with you. Yeah, you need to work with me and the medical professionals and the city administration here. And let's see what happens when we look at the numbers, less than a month. And if the vaccination rates go up and the infection rates go down, it says it right in the order here, we can rescind. Let's work toward rescinding this together, not increasing restrictions and or mandates. Last thing I said it before we closed out when Helen and I, a few weeks ago or a month ago, I will not be afraid to pull the trigger if we have to start issuing mandates or this or that. I don't want to do it. I want to avoid it if we can right now. But we are still in the midst of a pandemic. And I want to thank the public and the residents and the business community for your continued patience and collaboration. I know it's been average. I also want to thank my cabinet heads down to rank and file. Again, we've been tested and true through a number of natural and man-made disasters. I don't know if you have any other questions or comments for Dr. Kerouac, Dr. Roos, Commissioner Colton Harris, City Council President Marcus Williams. And they're all available if you want to do separate interviews. Thank you so much for being out here. Hopefully next time we have to come before you, it will be in celebration. Thank you.
They had a lot of fun.